Zing Health's regional broker director. And, it wasn't too many years ago that it's true. We were, just almost, I guess, for lack of a better word, just startup company based out of Chicago, Illinois. So we do have a corporate office here, and that's where I'm working out of and talking to you from today. However, we are in 6 states now. We are regional, mostly here in the Midwest. So without further ado, let's go ahead and get started. I do want to also introduce Michelle Skenendor. She's our national agency manager. She is not with us today. However, she is a great resource and a point of contact. You can scan her QR code here as well. I know she interacts with a lot of the Messer back office as well as some of the agents as well. So again, introducing Zing Health to some of you that may not know who we are. We are physician founded. Dr. Eric Whitaker is our founder, one of our co-founders, born and raised in Chicago, saw a lot of healthcare disparities in the marketplace as he was even growing up. And when he opened his first practice back in Chicago in the 90s, really took a very unique approach to things. This was before, social determinants of health was even a phrase. He was identifying that and, including, parenting classes and resume writing skills and a barbershop in his clinic and things like that were really outside of the purview of normal healthcare. But he saw it as a way to, again, positively impact the health of individuals and the people that were coming to his healthcare clinic. Well, back in 2018, he had this brainchild. He wanted to start a Medicare Advantage company that would focus on those social determinants of health. And lo and behold, he came up with Zing Health, and we launched in 2019. Really happy to say that I just had my 5th year anniversary with Zing Health just about a week and a half ago, and have just seen tremendous strides and growth in the marketplace. So looking forward to sharing this presentation with you today. But I would be remiss to not cover some of the awards that we've been identified by Health Metrics Research for in 2025. And as you can see here on the screen, in all of our markets, we have been identified as having just being an excellent performer in the Part D space in our Elite, Select, and Select Care HMOs. But it doesn't just stop there. Our CSNP products have really taken hold, and that really is our primary focus as an organization. But some of the other things that we, again, really kind of are proud of are differentiated product designs. The differentiated product designs are really, again, just a fancy word for, focusing on the needs, the real needs of our members and beneficiaries in the service areas that we are in. We also have an industry-leading customer experience. What does that mean? It means that we really take a member-first approach to engaging our membership and ensuring that we are, through integrated care delivery, giving a member that real kind of high touch, providing them a roadmap of how they can better address their healthcare needs and put them on a path to living healthier and happier lives. And of course, I would, need to talk about our robust sales and marketing. So we've got some great tools. I'm going to share some of those with you today. And, in terms of engagement, I do want to share that I have a team of regional broker managers in all markets, from Illinois, Indiana, Ohio, to Michigan, Tennessee, and Mississippi as well. Now, just real high level numbers in terms of what we've seen in the last 12 months. I just mentioned our states there on the right that we serve, but if you can just put your focus on the number on the left there, over 71% of all of our members are enrolling into special needs plans. To be specific, chronic special needs plans, and you'll see diabetes, cardiovascular disease, chronic heart failure, and ESRD are those chronic conditions that a majority of our members suffer from. So our plans are really designed to treat those conditions at a very high rate of engagement. And boy, I'll tell you, it wasn't too long ago, literally probably 2.5 years ago, when we were just starting to, find our stride and, get the attention of not just brokers like yourselves, but also the beneficiaries that would become members in years to come. So we're really proud to say, last year we had a jumping off point of about 9,000 members. This year we're at 31,000. It's closer to, heck, probably 34,000 here for 8/1 and going into 9/1 effectives. Why is that? It's because C-SNPs can be sold year round. And so we're seeing tremendous growth and attention on our products here right now during lock-in. But if you can imagine, even during AEP and OEP especially, we have, our C-SNP products are the fastest growing products in our portfolio. Now, in terms of geographic footprint, we've already talked about the states, but as you can see here, we will be in 52 counties across 6 states, with expansions, in Michigan, Ohio, and Tennessee, to be specific. Now, in terms of our product portfolio, we have 27 HMO products that we offer across all of our markets and 6 PPO products. So that's 33 plans in 6 markets. And if you break it down even further, you can see again where our focus lies, and that's in the C-SNP space. We have 21 plans in those 6 markets, and you can see state-specific plans there on the right. So there are certain plans that are only offered in Illinois and Indiana and Michigan, Tennessee. But then we have some, our C-SNPs to include our PSP, our provider-specific plan. I'll talk about what that means and what that looks like here momentarily, as well as our ESRD, or chronic kidney disease plan, is in all markets across the board. And this year, we're really excited for a new product in Michigan. It's an overweight obesity C-SNP. So it's focusing on folks with, a BMI of 30 plus, as well as some other criteria. And then we also have a new plan that is LIS focused as well in Illinois and Indiana. Just to give you another visual of what that looks like, though, again, on our left, you'll see HMO, PSP, and PPOs. Those are our core or general enrollment types of plans. And then on the right, in the color, you'll see the C-SNP plans to, again, include HMO and PPO C-SNPs. We have PSPs, LIS focused, dual focused, ESRD, and that obesity plan that's new for this year in Michigan. Really excited about that. But let me take a moment to talk about PSP, provider specific plan. Now, it wasn't, too long ago, literally in the last year and a half, our only partner in the PSP space was Oak Street Health. And as you can see, the service area, they have locations in all of our markets. But we've just recently added Village Medical, or Village MD, and Absolute Care as well, just literally this month in Illinois and Ohio. Now, all of these partners are value-based. And what does that mean? It just means that these plans do require that a member see a primary care physician from one of these 3 entities if they should enroll into a PSP product with us. And we designate that by a name of Elite. So whenever you see the word Elite PSP, that means that a beneficiary must choose their primary care physician, again, from one of these 3 entities. Now, in terms of the chronic special needs plans as a whole, we really, I don't want to say we necessarily do things differently, but what we do is we want to be as inclusive as possible when it comes to, again, offering benefits that really kind of impact, our members in a very broad, sometimes general, sometimes very specific approach. And we do that by some of these key benefit highlights here, right? So in all of the C-SNPs that you see on the left in our markets, you will see transportation. You will see physician services of $0 copays, not just for primary care, but also for some specialists that treat those conditions that those folks are suffering from. Eye exams, of course, international coverage as well. But back to the RX, we have a tier 6 in our formulary, which offers $0 copay. That's been a real winner for us in the last couple of years. We carve out a 6th tier in our formulary and our C-SNP plans that include some of those very kind of, I guess, expensive brand name types of medications, think like Ozempics and things like that, the GLP-1s. And then we also have really, really competitive benefit allowances. Now, some carriers will go after this type of benefit, and throw a bunch of money at it and, sit back and create a lot of hoops for beneficiaries to jump through and hope that they don't utilize it. And that's not how we operate here at Zing Health. We offer a benefit allowance that covers in our C-SNPs, OTC products, healthy food, and utility services. There's even a couple of surprises there as well. We'll talk about that momentarily. We also offer in-home support services. Now, this has been a real winner for us. We partner with Papa. If you're not familiar with who Papa is, again, they are an organization that where they have their employees, Papa Pals, come into the homes of our members. And they offer, light housekeeping, meal prep. They'll even offer transportation. So that's yet another form of transportation that we offer to our membership through this benefit. Incredibly sticky benefit. Folks literally, I've heard story after story from brokers saying, hey, listen, don't get rid of that benefit. My client uses that and is probably their favorite benefit out of all the things that are offered in your plans. And then, of course, wellness, right? That you couldn't go without calling that out. Gym memberships, home fitness kits, which are really great. From walking sticks to the yoga mats and the stretch balls and all of that stuff, right? Our members can get those and still see or attend classes and or facilities as well. It's not an either or. So excited about that as well. And because all of those, all of those benefit highlights, right, are wrapped into all of our C-SNP products, it's made for a winning recipe for Zing Health in our service areas. But quite honestly, other companies are recognizing this need and filling that as well across the entire country. This slide really represents that. 34 million Medicare Advantage beneficiaries across the entire country, And with that said, there are 1.2 million enrollees. Now, just a couple of years ago, it was half that number. So this is one of the fastest growing spaces in the Medicare Advantage, lineup. And but yet there's obviously a huge gap between that 34 million and the 1.2. So there's tremendous growth opportunity in this space. You can see the percentage of beneficiaries that suffer from chronic conditions there on the right. Diabetes, right? 13 million beneficiaries. Cardiovascular disease, 28 million. Chronic heart failure, 7.8. And chronic kidney disease, which this year we've opened, or I should say CMS has opened up that space. Even this year, only folks with CKD level 5, which is basically designated as ESRD, could enroll into one of these plans. Now they've opened up to include all levels of CKD. So that's 17 million beneficiaries that could be eligible for these types of plans. Again, why sell a C-SNP? You can sell it year round. As I mentioned, we're having some of our best months right now as we speak. Lower member churn. Really, once a member gets onto a C-SNP, they see the added benefits, they see the added focus on their condition, and they want to stay. They're not looking around to shop for the next latest and greatest. Why? Because their health is getting that much better. Also, it's not nearly as the C-SNP space is not nearly as volatile as the D-SNP members out there, right? So there's a plethora of things why this market is growing at such a rapid rate. Now, one of the other things I do want to call out, though, is our cardiovascular disorders that we have included in our C-SNPs today. CMS really clearly outlines the different types of conditions that you see there on the left. And I do want to point out that the chronic venous thromboembolism is currently a condition that is included in our plans in 2025. In 2026, it's changing. And you can see right there that it's no longer going to include that, but in fact, it's going to include valvular heart disease. That's a little bit more of an inclusive condition. So we should see an increase of beneficiaries that are eligible for these types of plans in 2026. Now, to focus again back onto that ESRD or chronic kidney disease C-SNP, there are some key drivers as to why these plans are so successful and really catching the attention of folks that, again, not only suffer from ESRD, but in the upcoming year, also any level of CKD. But really, these plans are designed to treat folks with ESRD. Really, that's what I want you to focus on still. And why is that? $0 copay for dialysis. It doesn't matter if a person goes in for a dialysis once, twice, even 3 times a week. They're never going to pay anything out of pocket for that. They're also never going to pay for transportation or have to worry about transportation. As any of you may know, when you go to dialysis, you're not only in there for 3, sometimes 4 hours at a time, but you don't have any energy. You're not as you don't have the ability or capability to drive yourself afterwards. So a dialysis center will not let you drive. As a matter of fact, you have to have a ride. These plans have unlimited transportation, as well as $0 copay, again, to see nephrologists, endocrinologists, and so on and so forth. The annual out-of-pocket for these types of members, if they were on original Medicare, is between $6,000 and $9,000 a year. And typically, that's for folks above that dual space, right? Obviously, folks that have Medicaid and Medicare aren't really paying anything out of pocket. But there are a lot of people, let's face it, above those income thresholds that are really hurting. And if you're suffering from ESRD, this is the plan for you. We also offer, as far as network partners in the bottom left, DaVita and Fresenius. Now, it's not limited to DaVita and Fresenius, but the network is expansive and includes some hospital dialysis centers and other clinics in various markets. So I encourage you to look at our directory when looking at this plan. And I think you'd be very pleasantly surprised to see that there are a lot of options for beneficiaries that enroll into an ESRD plan. Now, in terms of the naming convention for our plans, just very quickly, I just want to have your attention go to the middle of the screen where it says keyword, and you'll notice from the top, select or open choice or elite. These this naming convention and these words are attached to the plan type on the left. So every time you see the word elite, that's a provider specific plan. Should you look all the way to the bottom and see the word balance, well, every time you see the word balance, that's going to designate our overweight or obesity plan, and so on and so forth. Sometimes you'll see multiple keywords in one plan. So just keep that in mind. You'll get used to it a little bit more as we kind of go through the presentation, as you actually kind of dig in and do some certification with us as well. But let's get started with some of the state-specific details. I really want to, again, focus on some of the high levels of these details. So we're not going to get deep into the weeds on this, but can provide all of that information to you at any time. With that said, we're in 12 counties in Illinois. We don't have any county expansion in Illinois this year, but over the past 5+ years, we've continued to expand this service area. And as you can see, the entire northeast to north central of the state is covered, all 12 of those counties. And in terms of our plan portfolio, we are renewing I should say all of the plans on this screen right here. We even have some expansion for that HMO product at the top. And this slide is broken down to general enrollment plans at the top. And then our C-SNPs are in the bottom. So we have two different types of C-SNPs. We have one that is inclusive of, again, cardiovascular disorders, chronic heart failure, and diabetes, type 1 or type 2, and then also chronic kidney disease. And you can see there's some other designations as well. Like, for instance, in the middle of the screen there, dead center, we do have a C-SNP that's dual focused for folks that are on Medicaid and Medicare. We also are launching a brand new product in Illinois this year, and it's a C-SNP with a focus on those that have LIS. Now, some of these plans are only available in certain counties. You'll notice that LIS plan is in Boone, Cook, Kane, Will, and Winnebago only for 2026. But when it comes to again, some of these details, I just want to real quick go over these slides and point out at a very high level by state some of the things that really should grab your attention. But this is in the top left corner is your Illinois 2026 general enrollment plan. So in Illinois, we only have HMOs. We do not offer PPOs. And here you'll see on the left the straight HMO, which again requires folks to stay within our network. And then on the right, we have a PSP. The PSP, provider specific plan. Remember, it requires a beneficiary, a member, to choose a primary care physician out of that network of Oak Street Health, Absolute Care, so on and so forth. And you'll see a little bit some richer benefits in that plan as well. But quite honestly, if you look at and again, these are not our C-SNPs. These are general enrollment plans. Look at the copay for specialists at $10. Again, we do not want to create barriers for folks that are on fixed incomes, even in a general enrollment space, where they have to make a decision on whether or not they have to put food on the table and or see their specialist. We want them to be able to do both. You see the big three of dental, vision, and hearing here. Transportation is on both plans. We even still include a flex card on the PSP, the provider specific plan. Now, on these general enrollment plans across all markets, you're going to see a quarterly OTC benefit. And remember, this benefit is a use it or lose it, so it does not roll over quarterly. But you will see a little bit further down below that we do have an SSBCI allowance of $75 a month on the PSP plan. But let's not oversell that because it is required that a beneficiary getting into this type of plan that we verify some of their chronic conditions. And quite honestly, some of those conditions would allow them to enroll into some of our C-SNP plans. And then you'll see the copays down there at the bottom on the RX. Let's pivot real quick to the C-SNP plans in Illinois. Again, you've got your straight HMO C-SNP on the left. That's in all of the counties. And then you have the PSP. Again, why is it in limited counties? Well, those are the only places that Oak Street Health has locations and or Absolute Care. But some of the real high level things, and you're going to see some of these benefit designs do not vary state to state, service area to service area. The copays, the amounts might vary just a little bit on some line items, but for the most part, you're going to see our C-SNPs all include these types of benefits. And again, I want to point out the C-SNP specialists are $0. And we list those 6 on the far right side: cardiologists, endocrinologists, gerontologists, nephrologists, ophthalmologists, and pulmonologists. And then if I just have you look down a little bit further, you'll see a very generous transportation benefit. But now what we're doing, if you look down even further, is we are in that PSP on the right side, we are actually including the OTC and the SSBCI food card benefit together. We're combining those, and it's a monthly benefit of $141. So if you take that times 12, that's a very generous dollar amount. On the left, in the regular C-SNP, we do have a quarterly OTC with the food card of $120 a month. And then this is your first time at the bottom to see that tier 6 on our formulary of $0. Here's the ESRD or CKD, I guess, benefit or plan design. Again, we do not take away supplemental benefits to ensure that someone can have $0 dialysis or unlimited transportation, but instead we offer very strong supplemental or ancillary benefits. And you'll see here again, ESRD members get unlimited transportation. They even get $130 a month for OTC, food, utilities, and you'll see something there that you won't see in any other type of plan this year. It's called RICS, but it's a reduction in cost. You can use your SSBCI benefit of $130 a month to pay for certain Part A and Part B service copays. Again, trying to encourage folks to be able to see their specialists and seek their care without having to decide whether or not they're going to keep the lights on or pay the rent this month. They're going to get to do both. And then lastly, these are our C-SNPs that are dual focused on the left, and then we have an LIS on the right. So the copays and coinsurances are going to be, follow those of Medicaid on the left at 20% coinsurance. That's how they're filed. Of course, it would be 0 if they're full dual. Same with the Part D at the bottom. But that plan there in Illinois, $180 a month in OTC food and utility. And then the LIS on the right is a PSP plan, okay? And so that plan there does offer coinsurances, but those are covered, right? If you have Medicaid, or pardon me, LIS. Now, in terms of our network, we have a very, very strong network in Illinois. Again, this is where we're founded and based out of. You can see a ton of different hospitals and clinics across the board in Illinois and all of our service areas. Very proud of that. Our network team has just done a tremendous job there. To focus on Indiana here, you can see that we are in the middle of the state primarily. Marion County is where Indianapolis is, but we have all the counties around Indianapolis this year, as well as Lake and Porter, which really are almost parts of Chicagoland, for lack of a better word, right? They're just across the border there. And these plans that we offer in Indiana, again, are in the general enrollment space. And this is your first time of seeing a PPO with Zing Health in Indiana. So you'll see that the service area counties listed up there for the PPO are all of the counties, as well as the C-SNPs. Again, pointing out that we have that new LIS plan kind of in the middle of the screen there in Lake and Marion counties only. And then we have our chronic kidney disease or ESRD plan there at the bottom. Again, I'm not going to spend much time on these slides here, but I do want to show them to you. But these slides and these plan designs, again, as I stated earlier, are very similar state to state, county to county, service area to service area, right? The specialist copays, 15, 10, and then the PPO, you do see a little bit of a bump on the PPO cost share, but again, you're kind of having to give up a little to get a little if you want that flexibility to go outside of the network there in Indiana. But again, the big three of the dental, vision, and hearing are relevant and intact. We offer a flex card in that PSP, which is in the middle, right? Again, think Oak Street in that case. And then, of course, we have some SSBCI benefits at the bottom, again, with the a 5-tier formulary on the general enrollment plans. Now, on the C-SNP enrollment plans, we, again, include that 6th tier at $0. Again, these numbers are very similar to what you see in Illinois, to include, this, again, the $0 for those C-SNP specialists on the right. And then the SSBCI benefits down there towards the bottom, you'll notice some of the plans have a quarterly benefit for their OTC. That middle plan, the PSP plan, has a combined benefit of $158 a month. And that, again, does not roll over month to month. You use it or you lose it. But again, very generous in that PSP. Here we see the LIS product that we have in Indiana. Again, it's only in Lake and Marion counties there in Indiana, but again, very generous. We have an SSBCI benefit, $195 a month, as well as again the copays there that align with the LIS. Now, in terms of the ESRD or CKD plan in Indiana, again, very similar to what you saw in Illinois, to include $141 a month in the SSBCI benefit with the unlimited transportation. Now, in terms of the provider partners, we have had just made leaps and bounds of forward momentum here with our provider partners in Indiana, Johnson Memorial, Hancock Health, Major Health Partners, Riverview, Whittam. All of those are new additions over the last year and a half, to include additional ones there that you see as well of IU, Ascension, Eskenazi, and Community. Now in Michigan, really excited to say that we're going to be entering a new county of Lapeer County. Again, kind of rounding out the general metropolitan area of Detroit, of greater Detroit. And again, you kind of saw that in the previous slides with Illinois and Indiana as well. That's kind of a strategy of ours. You come in, make sure that you have a strong network in a certain geographic area, and then build off of that as your membership grows. And again, here in Michigan, we've got one new plan this year in the middle. That's the one I was talking to you about earlier that I'm really excited about. And that's the overweight or obesity plan. Now, again, it's a CSNP. It's only offered in Macomb, Oakland, and Wayne, but those are the biggest counties. So, you should find a lot of opportunity. We also have some expansion in a couple of our general enrollment plans to include PPOs. Michigan is yet another one of those states, just like Indiana, that has PPOs for 2026. And then if you look down, the ESRD plan is expanding into that new county of Lapeer for 2026. So again, not going to spend a ton of time focusing on all the line items here, but you'll see very, very similar product design and numbers for that matter across all of our general enrollment plans. So it's the HMO on the left, the provider specific plan in the middle, and then that PPO on the right. Again, very similar in plan design as the other states, with the OTC being quarterly and the SSBCI benefit being monthly. Now, in terms of the CSNPs, again, this is our bread and butter. This is what is really the winner for us, in all markets. And again, you don't see us really, pivot away from a strong, plan design in terms of the copays of $0 for primary care and specialists. Even the other specialists, aside from the 6 that are on the right-hand side here in that box, the copay is only $20, right? So still very attainable, very affordable. And then you'll see again where we have some quarterly OTC, but that provider specific plan in the middle, we combine the OTC with the SSBCI, and we're also offering in Michigan only some air conditioning, benefit as well to be part of that SSBCI benefit. So we'll get into that when we get into some other slides here. And then you'll see the ESRD plan. Again, nothing really changed. And not to mention, the benefits for our obesity and overweight plan that is new this year. It's a new plan type for us. And, if you can just read the tea leaves a little bit, if this plan does become as successful as we think it will be, perhaps you'll see it in, other markets in years to come. But again, we don't pull out of, any of the benefits away from this plan, even though it's going to be pretty darn inclusive in terms of the demographic. So we will have dental, vision, and hearing, right? Still include transportation. There'll be the standalone OTC benefit and the SSBCI benefit as well. And then this is the one change up, though, in this plan because of those GLP-1 meds. Those meds will go from tier 6 to a tier 3 sometimes. And then also there will be a copay for those of $11 compared to the $47 on the general enrollment plans. In terms of the provider partners, we've added, some big players this year. Very excited about that, to include University of Michigan, Tenet, Beaumont. There's been a lot of shuffling around of hospital networks there in Michigan, and I'm happy to say we've got a vast majority of those already contracted. Now, in terms of Ohio, I've been spending a lot of time out there lately, and this year, for good reason, we have a new market within Ohio, and that is Toledo, Wood, Fulton, Lucas, and Ottawa. Really excited about this expansion. It's our largest expansion, in Ohio and all of our states. I'm not even sure if we're adding 4 there in Tennessee, but it's one of our biggest expansions for 2026. And again, the only thing that you see here different is that we are terminating a dual focus plan in Ohio. Again, there's a lot of, back and forth and a lot of, disruption happening in many states around the D-SNP market. And so you will see our dual focused C-SNP not renewing for 2026. Now, in terms of the general enrollment plans, again, our HMO on the left. And I just want to remind you, in Ohio, we only have HMO products, no PPOs, but we have that PSP plan on the right-hand side. And as you can see, very, very similar as the general enrollment plans in in Michigan, Illinois, and Indiana already that we've covered. In terms of the C-SNPs for Ohio, again, our general C-SNP, right, HMO C-SNP, cardiovascular disease, chronic heart failure, diabetes on the left, our provider-specific plan on the right. We are adding some additional counties that are bolded and are highlighted there in the service area. And then as you your eyes kind of go down the lines here, again, focusing on the standalone OTC and or in the PSP plan, that benefit is rolled into a monthly benefit of $174. Again, ESRD, very similar to the other states, and in all counties in Ohio. In terms of network, we have some work to do out there, but we're happy to say that Cleveland Clinic is part of the network. We've got Mercy Health, Oak Street, Absolute Care. We just added on for that PSP. So really excited. We do have some work to do. As I mentioned, I'd love to see another partner, and perhaps that'll happen here sooner than later, as I've gotten some good information from our provider team there in the Cleveland area. But all in all, still covers the entire service area there in Ohio. Let's pivot to Tennessee. We've got 4 counties: Williamson, Wilson, Sumner, and Robertson being added in and around the Nashville area, but we're also in Shelby and Fayette County in the Memphis area, and that's been a great market for us as we launched this market last year. And again, in Tennessee, we have HMOs and PPOs both, and you'll see that there's expansion into some of those new counties on the right-hand side in the HMO PPO space and the C-SNP space. Just a real quick glance at the general enrollment plans, the HMO on the left, the HMO provider-specific plan, and then the PPO on the right. Very, very competitive, I'd say, across the board. Again, if you look at the specialist copays, you look at the OTC and food benefits, either quarterly or monthly. And again, transportation on both of the HMOs. The PPO does not have transportation, nor does it have a flex card, but you do kind of have to give up a little to get a little in terms of flexibility on the network side. Now, if we look at the C-SNP, we do have 3 of those in Tennessee for 2026. We've got our Select, which is, again, kind of our primary C-SNP product in all markets, all service areas there in 2026. But then we have that PSP plan in the middle. Again, think Oak Street Health here. And, that's got $170 a month OTC food and utility benefit. And then the PPO, again, not too shabby at $75 a quarter on the OTC and $120 a month on food and utilities. And then the ESRD plan as well. So again, hopefully you're seeing a pattern here, right? All of these plans are very similar across markets. You're not seeing a ton of differentiation between markets, even on the dollar amounts. And here you'll see Memphis and Nashville in terms of our provider partners. Some work to be done in the Nashville area, admittedly, but we do have HCA and Nashville General, and we also have those PPO products as well. So keep that in mind. Great partners in Methodist Regional 1 and St. Francis there in the Memphis area. And lastly, we're going to wrap it up with Mississippi. We're in the 4 counties, kind of across the border from the Memphis market. So Tunica, DeSoto, Marshall, and Tate. Everything's renewing there down, for 2026. Want to remind you that they're all HMO products. And again, just more of the same here. You're not seeing any outliers in terms of plan designs for the general enrollments, for the CSNPs and the PSP and the ESRD plans. So again, just wanting to make sure that I really drive home that point that, it doesn't matter where you are a Zing Health member, you're going to enjoy those same benefits. And to include, these going to these provider partners in the Mississippi market. I wanted to remind you also that we do have reciprocity. What does reciprocity mean? It means that a Zing Health member that lives in Mississippi can cross a state line and go to Methodist there in Memphis. If they wanted to go to Cleveland Clinic in Ohio, they could do that. We have reciprocity across all markets and all hospital systems that are currently contracted with us. In terms of our formulary, I mentioned this earlier, we have a 5-tier and a 6-tier formulary. The 5 tiers in our general enrollment plans and LIS-focused CSNP plans. And then we have a 6-tier formulary in the rest of our CSNP plans. Just more of the same. I should have left that one out, but I do want you to focus on that tier 6, right? That tier 6 formulary in our CSNP plan is what has really caught the attention of the markets in the last couple of years. And this year, we're really happy to say that in our tier 6, we are including for the GLP-1, the Ozempic, which does require prior authorization. It must be prescribed for diabetes. But also you'll see the other ones here, Mounjaro, Entresto, Januvia, so on and so forth. Again, this has been a winning combination for us in years past. Now, in terms of formulary insulins, we offer $0 copay for all of our formulary insulins that you see listed here across all plans, not just CSNPs, but even the general enrollment plans. We do have people that are in a general enrollment plan that are not in a CSNP. And quite honestly, we made this change to $0 copay for our insulins before the prior administration had even reduced the insulins down to $35. So we were already ahead of the curve and saw how much of an positive impact this had on our members. And it's quite an extensive list to include tablets, capsules, liquids, powders, gels, injectables. And then here's a tier 2 med that sometimes catches people's attention. Dr. Whitaker, when he's out talking to brokers, likes to kind of joke that we're helping members get their Zing back with including sildenafil on our formulary. But it is true, and we offer those medications in 25, 50, and 100 milligram capsules. One of the other winning parts of our plans is our CGM. Now, the CGM, or continuous glucose monitor, is offered in every single plan that we have across all markets. It should also be stated that the best way to get this at $0 copay is not through your DME provider. You're going to pay a 20% coinsurance if your member tries to get a CGM through their DME provider. All they simply have to do is have their physician write a script. They take that script to the pharmacy, and the pharmacy would fill this at $0 copay. And just as a reminder, the CGM brand is Dexcom 7 or Dexcom 6. These are great devices. They have helped family members of mine. They use them today and can't say enough about them. We also offer, again, if CGM is not for you, diabetic test strips if you're diabetic, again at $0 copay, only when a physician prescribes it and fill that script at the pharmacy again, just like with the CGM, right? And we offer AccuCheck and True Metrics as far as test strips at $0. So again, remember, go to the pharmacy, not the DME, to get this at $0 copay with Zing Health. Now, in terms of just some pharmacy FAQs, we do partner with CVS Caremark for our mail order pharmacy. We always include some of the pharmacy processing information there in the middle in case you've got a member who's maybe they enrolled at the end of the month. They haven't gotten their member card, but they've got a script to fill. This is very accessible information that we can provide any beneficiary or member of Zing Health at any time. In terms of our supplemental benefits, we do have mandatory supplemental benefits and not optional supplemental benefits on our plans. What does that mean? Well, quite simply, it means that mandatory means that these supplemental benefits are on all of our plans. Okay, they're just automatic. Our members automatically receive those, and it's not a pick and choose as you would see underneath the supplemental benefit side of things. And then also at the bottom, I want to just point out that VBID and the VBID model is ending in all Medicare Advantage plans for 2026. So you may have beneficiaries that are in a particular plan with a carrier today where they're getting their OTC and food card through the VBID model, which is, again, dependent upon their level of LIS and all of that. So it's income based. In the upcoming year, that's going away. All of those food and utility benefits will be filed using SSBCI only. Now, in terms of, again, the big three, the only thing I want to point out here is that dental, vision, and hearing is both comprehensive and preventative in nature, and you never pay a single dollar out of your pocket as a Zing Health member from the first dollar spent all the way until the maximum limit. And in those PSP plans, you even have a flex card that will cover the dental and the vision benefit as well. Some of the other supplemental benefits, again, these are all mandatory, right? They're on all plans, are the OTC, as well as those SSBCI benefits, and then we have that reduction in cost sharing, that RCIS. Now, remember, that is on that ESRD or CKD benefit plan design, where folks can use that card to pay for select medical copays and co-insurances, as well as rewards and incentives. We do offer, some additional dollars to people that get their yearly checkup, their mammogram, their colonoscopy, things like that. Now, in terms of our debit card benefits and changes, again, no VBID for the upcoming year. It will all be SSBCI. And that flex card, all of those benefits come on one card to include your OTC, your healthy food and utility on one card. So our members have one card that's their member card, right? It has all their medical information on there that's necessary to include their primary care physician. And then the other card is their debit card, and it will include all the other benefits that we discussed today. And it does come activated, so they get that in the card and they can go and use it on day one. Now, in terms of healthy food in grocery allowance, I do again want to reiterate that they must be verified for their chronic condition. But if you enroll into one of our CSNP plans, not the general enrollment, but the CSNP plan, you'll get that benefit from day one. Now, one of the other things that we offer, post-discharge meals, that's pretty standard in the industry, but our chronic condition meals are something that's unique, and we do offer between 14 or 28 meals a year. Our CSNP members can have these meals once they meet with a nutritionalist to determine whether or not they have any, dietary restrictions, right? Some people, may need a low sugar diet. Some people may allergic to nuts, things like that. We will then send those chronic condition meals out to those members. It's a great benefit. And then also at the top, the in-home support services with PAPA. It's been a great, sticky benefit for us, as I mentioned earlier. We also offer PERS. That's on all plans, right? That are qualifying. We also offer bathroom safety devices. Now, bathroom safety devices, that is just something that is kind of unique in the market. These are typically higher priced items that are included in an OTC, catalog. But with our plans, we offer zero cost bathroom safety devices. Every member can, I believe, get 2 this year. And that includes like shower benches, grab bars, shower wands, things that would really eat into your OTC benefit. Not with us. You're going to get those, outside of that OTC benefit, which is a nice savings. The utility allowance covers heating, oil, water, not gas at the pump. And then, as I mentioned, in Michigan, on certain plans, we will be giving an SSBCI allowance for reimbursement on air conditioning unit filters and or the actual air conditioning units. So that's a new benefit for 2026. In terms of transportation, as you saw earlier, all of our HMO plans have transportation with the exception of the PPOs. But then we also have that in-home support service benefit that's also transportation, and it's provided by PAPA. So think about it this way. If you need to go to the pharmacy or a doctor, use your non-emergency transportation with Zing Health. But if you want to go shopping at Walmart, or you need to go pay a bill, or even heck, see a friend, right? And you can do that, but use your PAPA benefit. It's a tremendous benefit and add-on. We also offer, again, fitness and gym offering on all of our plans, nutrition and dietary counseling, and the worldwide emergency coverage. And of course, provider advice line and telemedicine, all at $0 copay. Those are great for after hours and weekends. And then let's just take a quick pivot here because we're kind of wrapping up our presentation. I want to let everyone know that we still pay for HRAs into our CSNP plans. So at the bottom there, you'll see that we pay $100 HRA compensation when enrolling a beneficiary into a CSNP. Now you'll get reimbursed or paid that dollar amount after 90 days of membership. We also have a standalone HRA URL in case you're not doing your enrollment through Ascend or Sunfire this year. That's changing for 2026. We're going to talk about that momentarily. But let's pivot real quick to the SSBCI HRA requirement. Now there are some things to call out here. The general enrollment plan and the obesity plan, you'll see that there's not a requirement for the HRA, but it's still helpful. You're not going to get paid for that HMO, PPO, HRA up top. But heck, I'll tell you, if you want your member to get that SSBCI food card benefit in a general enrollment plan, number one, they have to suffer from 2 confirmed conditions. But again, some of those conditions, such as cardiovascular disorder, chronic heart failure, chronic kidney disease, or diabetes, those would allow someone to enroll into a CSNP. So there's no real need to even consider them for enrolling into a general enrollment plan should they suffer from one of those. But if they have cancer, dementia, right, chronic lung disorders, that would allow them to get those SSBCI benefits in the general enrollment and or overweight obesity plan. In terms of the CSNPs, the HRAs are required. And so those have to be done in the first 90 days if they want to continue to get that benefit. Our members must do that. That's why we ask you in partnership to do the HRA, and we'll pay you that $100. You get a 7-day window to do it. But heck, you may as well do it right there on the spot when you're doing the enrollment, right? I mean, if you're doing the enrollment, spend an extra $5. It's not going to take you more than 10 for sure to get that HRA done and get paid an additional $100. Now, in terms of some of the significant benefit changes, there really isn't a lot, but we do want to bring to your attention, if you sold our products in the past, right, that our ESRD and our CKD plans really focus on level 5 of CKD in order for folks to get the unlimited transportation, the $0 dialysis, and the $0 specialist visits. If they have another level of CKD, they're not going to get all of that stuff. They'll get a portion of it for the unlimited transportation. It does drop down, but they still get transportation. Some of the things that are no longer offered in some of our general enrollment PPOs are the cost share parity, the PAPA benefits not included, other than the CSNP PPO, things like that. So just keep that in mind. In terms of broker support, I'm happy to say that we do have a verification line, but we also have a broker support line. And I encourage you to utilize that support to help address your needs as a broker. I do want to call out that you don't want to call the broker support line with a member. If you have a member on the line, please always call customer service instead. Now, in terms of enrollment options, this year we use Ascend on the left for our kind of in-home or in-house Zing branded enrollment tool. Starting in 2026, so very soon, in literally 5-6 weeks, Sunfire is going to power our Zing Health enrollment platform. Okay, but that doesn't mean that we don't offer or extend an invite and accept applications done through Connecture or Health Sherpa or Sunfire if you're using a third-party enrollment tool and your upline or your FMO is using one of those. We do accept enrollments through all of those, to include good old-fashioned paper applications, and you can fax those down there at the bottom as the number. And then just to kind of wrap things up here, we've got a great CSNP verification process. Up until last year or through last year, all of that could be done automated. CMS through the entire industry. A curveball this year was saying, hey, you got to get a signature from a physician to get this done. And I'm happy to say that we're at an 84% verification rate to date, which I think is probably, I'd challenge you to find any other carrier that's verifying those conditions at a higher rate than that. Now, again, it's a process, it's a partnership to identify that condition and confirm it. This year, we're initiating a 30-day pending verification text message. It's going to go to you should you have a member that enrolled into a CSNP and they still have not been verified after 30 days. You're going to get a text message alerting you to the fact that they're not verified. And then we really kind of have to turn it into high gear to address and reach out to the primary care physician and things like that. This VCC form is what needs to be signed. However, it doesn't necessarily have to be signed because the PCP or physician, nurse practitioner, physician's assistant can call into a phone number to verify the condition as well, and or fax this in or email it to us. So we have many different ways. This form is very concise, to the point, and again, our verification rate's at 84%. And one of the other things to call out is our value-based care providers help with that verification in terms of a bulk upload. So Oak Street Health, which is our biggest partner in the value-based care space, does a great job at verifying conditions for the CSNP at a very high rate. Again, because they're doing some bulk uploads with us. Now, in terms of phone numbers and whatnot, this is just some housekeeping stuff. You'll be able to find this at our website, as well as in our First Look website as well. I'm going to share those with you momentarily, but I encourage you to get certified with us. We use Evolve. I've had great broker feedback in terms of this year's certification. Very easy to manage and to get through. Going to want to look for that green check mark. If you go to myzinghealth.com, that is our official website for the company, and there's a broker tab. That's where you can find a ton of different information, to include broker tools, forms, resources, provider directory, a link to your dashboard in Evolve, where you'll hopefully see that green check mark, and then also track your book of business, look at your pay statements, all of that. And then as we kind of round it out here, headed to home, we've got a broker portal. Again, pardon me, not the broker portal. There we go. We have a great supply and marketing portal. And we've got a great partner in Michigan, TGI Direct. And that's where you're going to pre-order your 2026 enrollment kits. You can do that live right now. We're going to have those in everyone's hands by that first week in October. But you can also personalize brochures, flyers, and postcards, and really kind of step up your game in terms of leaving materials behind at events, at doctors' offices, or doing mailers. Now, if you want to review any of the information that we covered today, go to zingfirstlook.com. That is where you're going to find all the information we covered today and a lot more, honestly. Way too much to cover in an hour's time. So I encourage you to go to zingfirstlook.com. We also have marketing outreach specialists in every market. That's all those folks are on Iretha Jones's team. Very excited to have all those folks helping support brokers out in the communities, doing lead gen activities and engaging our membership as well. But with that said, we are at the end of our presentation. Thanks for sticking with me. It was a lot of information. I encourage you again to scan this and to go ahead and just reach out to me if you have questions, and or Michelle Skenendor, again, our national agency manager. And thank you, thank you, thank you. We'll see you out there in
Thank you so
2026.
much, Jason. Yes,
Yes.
absolutely. This was fantastic. Thank you so much for cramming all this. It was very, very informative. Um,
Yes.
in the hour, like you mentioned,
Yeah.
Zinc has amazing products. I am so excited for our brokers to be able to offer their products.
Yeah.
And if you go, would you go back to that page that says the certification, just so we have our agents take a look at that again, how
Oh,
quick and easy. I love how
yeah. This
you
one
all
here.
saw.
Yeah.
Yes, perfect. You thought of everything. I love that. I know some carrier, we do this with often with so many partners, and you guys put that in here.
It's
The
true.
social media information, that's always so helpful. These are questions that come along a lot to agents, like how long does it take the certification? If I don't pass, what happens? But I see that it's perfect. You guys give 3 attempts. And
Yep.
for you all folks, obviously Messer Financial has their own quoting tool, my MFG, so you can quote Zing through there as well. I'm hoping at some point we'll be able to have it enrolled through there as well. So that's a definite conversation for us to have. And um, again, I think we have the questions that we had were kind of answered throughout the presentation. So if there's any other questions, like you mentioned, you can use a little screenshot or reach out to our folks
Hmm.
on our marketing team. If you call 866-568-9649. If you missed any of the important information from today, just speak with our marketers, and you can also obviously reach out to Zinc Health. Would you put your information, the broker wraps on the screen again, Jason, just
Yeah.
so that folks can actually take a screenshot on your
Which
right
one is that
side?
again?
Oh, wait, go back. The broker's information, that one. Perfect.
This one.
Yes. So
Okay.
that if
Yeah.
they have additional questions, they can reach out to them.
And
Um,
just so we're clear, these are marketing outreach specialists. So we actually have
oh,
regional broker managers in all markets as well. My apologies for not having
hmm
those slides on. We have got Alex Gutierrez in Illinois. We have Nick
hmm
Poirier in Michigan. We've got Sarah Newman in Indiana and Paul Richardson in Tennessee, Mississippi. And I'm
nice.
actually interviewing for Ohio right now, so I'll have someone in that spot as
Okay.
well. But I'm covering that myself until we get that filled. So my apologies for kind of misguiding you there. These are not the
Oh,
regional broker
no worries.
managers; these are the marketing outreach specialists, but still
Well,
very helpful.
yes, that's a leeway. I was gonna say, if you'd like, maybe you shoot over to us the broker reps, and then I'll make sure that that's
Absolutely,
available for them to access. And
yeah.
so, tell me more. Like, not often, carriers share like a marketing outreach specialist. Are those
Hmm.
that work alongside the VBC partners, or
Yeah, they do.
how do this
Yep, they
coordinate?
do some of that as well. Those folks, are out in the field and they are actually they're working side by side table and chair events, right? We do a lot of
Hmm.
member engagement events, and so we have some
Okay.
brokers that have, let's say, 10 or 11, 12, 15, 25 members, and we're
Hmm.
doing member engagement events just for those with just that broker. So we'll do like a bowling event, for
Oh,
instance, and we will
yeah.
only invite that broker's members, and they can
Hmm.
go and engage, Zing Health and ask questions and get things, kind of shored up at those events. But as I just
Oh,
mentioned, I
amazing.
just here's all of our broker managers. So Nick Poirier is in Michigan. We've got Paul
Mhm.
Richardson in Mississippi and Tennessee,
Mhm.
Sarah Newman in Indiana, and Alice Gutierrez in Illinois.
Oh, fantastic. Thank you.
Yeah,
So I am
absolutely.
very excited. So let's say I'm a master agent or a new agent with saying I
Hmm.
contract, I pass my certification, I get some
Hmm.
marketing materials that are already kind of, I can edit to put my information from social media. I'm all ready to
Yeah.
go.
Hmm.
At that point, let's say I don't have, let's say I have clients, right? But maybe I'm brand new, not that many, and I'm trying
Hmm.
to grow. Could I reach out to a marketing specialist and see if there is opportunity for a table?
No,
Is that what that is for
no,
too?
yeah, absolutely. No, absolutely, you can. And I would encourage you actually to start with these regional broker managers that I'm putting up on the
Hmm.
screen. The reason why I
Hmm.
say that is they work shoulder to shoulder with the marketing outreach specialists, and so they're going
Hmm.
to want to engage you at a higher level. The broker manager will, and then once kind of we know you're up to speed, and we know what your needs are, or how you're trying to focus your business or hone it to a specific cohort of beneficiaries, then they can kind of in partnership with the marketing outreach specialist make sure you're hitting it out of the park with Zing Health.
Perfect.
Yeah,
Fantastic. That has been wonderful, so informative. I'm so excited that there's such a the story of Zinc Health is very inspiring. A doctor who decided to bring
yes,
a better product in the market and saw the gaps. So it's always really
yes.
nice to see something like this. And absolutely, you guys have a fantastic plan. All the overviews were fantastic. So um with that said, if you have any closing words, thank you so much for joining us today. And everybody, thank you so much for being here with us this morning.
Yeah, thank you, Sophia. Again, first time in front of the Messer agents today, and
Mhm.
I've heard nothing but great things about your organization. Looking to have again a great 2026, but I'll also want to make sure that y'all realize we're not just throwing up a bunch of fancy benefits or rich benefits and sitting back and hoping that folks aren't utilizing them. Zing Health really is about access to care and to benefits and encouraging members to utilize those because we see the results, right? We see folks getting healthier, and again, that leads to a stickier member for you, right? Addressing those needs head on. We're not perfect, like all carriers are not perfect, but I'll tell you what, we've got a robust team of broker support agents, regional broker managers, and we always do what's right by the member. So I appreciate your time today, Sophia.
Thank you. We appreciate you. I hope you have a wonderful rest of your week. Thank you,
Thank you.
everybody.